Good evening, everyone. Thank you so much for attending and participating in tonight's workshop. Um, everyone just let me know that they can hear me. That's wonderful. My name is Theodora, and I will be the facilitator of tonight's Understanding Mental Health Care in Ontario workshop. Okay, so just to give a quick breakdown of our agenda for tonight, we are going to start with a couple warm-up group questions and an interactive poll just to break the ice between participants. And I also want to give everyone a chance to better wrap their minds around some of the context in which I will be speaking tonight. I will address some recent key statistics regarding mental health challenges in Canada. We will then discuss definitions of mental illness, mental health stigma, disability, and the overlaps between mental illness and disability. I will provide an overview of Canada's mental health care system and how it's structured. And then I will provide some avenues to help you navigate the mental health care system through highlighting several referral pathways and their eligibility criteria. And this is for both adults and children and youth. Afterwards, I will go into some online mental health self-assessment and self-help tools. And finally, I will wrap up this workshop with multiple community mental health resources that are specific to diverse cultures and empowering marginalized populations. And I will attach an infographic with with their contact information at the end. Before we get into all that, I want to go over some housekeeping/etiquette rules that are specific to a professional Zoom environment, and I don't want to assume that everyone here is already an expert on these rules. So for this workshop, I ask that you please keep your microphone muted unless you're speaking, just to minimize any outside noises that could distract participants. You are welcome to turn on your camera, but obviously it is not mandatory. Totally up to you whether you want to keep your camera on or off throughout this workshop. Please feel free to use the chat anytime for questions if you are unable to use your mic or if you just prefer to use the chat. The topics being addressed can be sensitive subjects and potentially triggering, and therefore I ask that everyone just please be respectful towards everyone's views, experiences, and opinions. We are all here to learn from each other, and including myself, and any judgments or inappropriate comments or dismissive attitudes won't be tolerated. If there's something you may feel needs to be further clarified or elaborated on, the best approach would be just to ask questions. And on that note, if at any point a participant shares a personal experience, please respect their privacy and confidentiality. Whatever is being said in this workshop remains in this workshop. And also, lastly, please feel free to take a break at any time. I'm going to give maybe a small 2 to 3 minute break just to stretch. However, if you need to leave at any point, step out just to use the bathroom, grab a snack or a beverage, attend to a loved one, whatever, you are obviously more than welcome to do that. Okay, and for our land acknowledgement, OneHub growth respects the diverse culture and history of Indigenous people. This territorial land acknowledgement addresses historical injustices against Indigenous people and acknowledges that Toronto is on Indigenous territory. Between 1781 and 1930, Ontario entered into 46 land treaties with First Nations. Toronto was originally home to the Haudenosaunee, Anishinaabe, Chippewa, Wendat, and Mississauga of the Credit. We also recognize Treaty 13, which applies to the Toronto area. OneHub Growth expresses gratitude to all communities affected by the treaty, including those who are involuntarily brought here to settle, especially those deeply impacted by slavery. Through this statement of appreciation, we extend our sincere respect to the descendants of African heritage. And in this second land acknowledgement is an African ancestry land acknowledgement, and it is from the excuse me, the City of Toronto. And so the City of Toronto acknowledges all treaty people, including those who came here as settlers, as migrants, either in this generation or in generations past, and those of us who came here and those who came here involuntarily, particularly those brought to lands as a result of transatlantic slave trade and slavery. We pay tribute to those ancestors of African origin and descent. And though I am not a person of African descent, I am committed to continually acting in support of and in solidarity with Black communities seeking freedom and reparative justice in light of the history and ongoing legacy of slavery that continues to impact Black communities in Canada. As a part of this commitment, I would also like to acknowledge that not all people came to these lands as migrants and settlers. Specifically, I wish to acknowledge those of us who came here those who came here involuntarily, particularly those brought to these lands as a result of transatlantic slave trade and slavery, and in support of the City of Toronto's ongoing efforts to confront anti-Black racism. I pay tribute to those ancestors of African origin and descent. Lastly, OneHub Growth Mission. So, OneHub Growth is a non-for-profit organization that aims to address individual and structural barriers faced by disadvantaged individuals. The term OneHub means an integrated place for people, and growth means fostering a growth mindset among us, driving us to help one build their community, connections, and security. OneHub Growth believes in the power of community work to create equity impact. Since 2022, we have used a social work lens to get a clear direction for our organization, working with vulnerable populations, including seniors, newcomer youth, newcomers, low-income families, and individuals with special needs. We bring our mission, vision, values, and mandates to life by reducing local poverty and maintaining the well-being of vulnerable populations from a social determinant of health perspective. Our service delivery and practices are culturally competent, prioritizing the best interests of service users within our compassionate community. Okay, so just a little bit about me, the facilitator. Like I said, my name is Theodora, and I'm a research support officer for OneHub Growth, and I've been here since June 2026. I graduated from York University with a Bachelor of Social Work and a minor in HR Management in June 2025. I am a registered social worker. However, I want to preface this workshop by stating that I am not a mental health professional, and the primary purpose of this workshop is mental health resource allocation. I am also enrolled in a Master of Arts in Early Childhood Studies program at Toronto Metropolitan University. And fun fact about me, I am a martial arts instructor. I'm actually a 5th degree black belt in Taekwondo. So now I'm going to turn it over to you folks for a second. I'm going to stop sharing my screen just so I can see you unmute your mic or your hand raise, or just better see the chat. Just 1 second, please. And then I will reshare the presentation. So my question was to you before. How do you define mental illness? Now, I do want to also say, I don't want you to focus on what's the right or wrong answer. Just go for it. Just take a shot. You can either unmute or you can type it in the chat. I will type the question in the chat again. I'll give you just a couple seconds to formulate your thoughts. We'll give it another minute. Well, I just want to make sure I didn't miss anyone's hand. Experiencing social isolation, yes. Yeah, that's definitely one. Anyone else? Existing or developing mental conditions that harm people's lived experiences. Mhm. Yep. Thank you, Liam. Okay, I think we're going to move on from that question. I'm going to reshare my screen again. Okay. My next question to you is more of a poll question. So that is on a scale of 1 to 5. If you were to access any mental health support in Ontario, how comfortable do you feel accessing this support? So 5 is like the most comfortable and 1 is the least comfortable. So you could just share your answer in the chat. I can see the chat just fine without having to stop sharing. 1. Okay. 5. 5. Okay. 2. Okay. All right. Okay. Very diverse answers. Hey, you don't have to justify your answer. You just have to, all you had to do is just give a number. Okay, and my last question to you, again, you can just feel free to type this in the chat. It can be a one-word answer, it can be more than one word, but how would you describe your knowledge of current immediate mental health tools? So would that be maybe limited? Do you feel like you're familiar with them? Like I said, there's no really like a right or wrong answer. It's just based on your experience. If you have any personal experiences. Don't even know what Dennis says. I don't know what are mental health tools. Okay. Um, and this could be like any online, like I'm going to give an example, like any online tool, any online self-assessment tools that are kind of used to um, measure symptoms, anything like that. If you don't have any knowledge, that's all good. We're going to get into it very shortly. Okay, so with that being said, hey, so we're gonna, like I said, we're gonna get into that a little bit, but first, just a little bit of mental health statistics that are fairly recent. So, 18% of Canadians, 5 million, met the diagnostic criteria for a mood, anxiety, or substance use disorder in 2022. 1 in 3 of Canadians with a mood, anxiety, or substance use disorder reported unmet or partially met health and mental health care needs. So globally, an estimated 12 billion working days are lost a year. Sorry. Are lost every year due to depression and anxiety. Approximately 1.25 million youth in Canada need mental health supports every year. Nearly 3 in 5, so that's 57% of those youth are not getting the help they need. And youth have lower mental health indicators compared to other ages. Yeah. So I heard a couple answers on what is mental illness, and they're all correct, but the dominant definition of mental illness is so mental illness is a wide range of health conditions impacting individuals' thoughts, emotions, and behaviors. It can manifest in various ways and potentially interfere with one's relationships with others, personal well-being, and their ability to contribute to society. And it can manifest in a Sorry, just 1 second. Just checking the chat. Yes, Amish, yes. Okay, excuse me. So, so yes, mental illness can manifest through anxiety, trauma, feeling perpetually sad and upset, eating disorders, constant feelings maybe of confusion, extreme mood extreme mood fluctuations, so emotional highs and lows, withdrawal from friends and family, severe fatigue, low energy, inability to cope with daily tasks and challenges. And of course, this list that I just mentioned, these list of symptoms are not like it's not limited to that. Like so many more symptoms, but I just wanted to name a few. Okay, so some barriers to accessing support for mental illness can consist of long wait times to visit health professionals, geographical locations, namely living perhaps in rural areas where visiting a mental health facility is perhaps physically inaccessible due to distance or long transportation. Also, from a more personal perspective, like living in a state of denial over mental health concerns because the first step to being able to effectively manage mental health issues is first acknowledging the existing, I'm going to say problems slash symptoms, perhaps limited availability of service providers. And also a big one is lack of awareness on the actual publicly funded resources and both physical and virtual tools. I wanted to do a separate section for mental health stigma because this is quite significant in terms of in terms of the difference between people accessing and choosing not to access support. So, mental health stigma is defined as the negative societal attitudes, beliefs, and stereotypes propelled against individuals with mental health issues slash concerns. It can prevent people from pursuing care or support needed to address their challenges due to fear of judgment and ostracization. It can be both subtle and overt in nature. And stigma also derives from a fundamental lack of knowledge and awareness on mental health issues. So um, it derives from those myths around people with mental illness. And also, there are three primary categories of stigma, and that includes structural, public, and self-stigma. So, what is structural stigma? Structural stigma is basically the laws, policies, regulations, and cultural norms that deliberately or inadvertently limit the rights and opportunities of those with mental health concerns. Examples of structural stigma can include reducing funding towards research around mental health, scarce availability of resources specific to mental health care, and also involuntary psychiatric treatment can be a form of structural stigma. Public stigma, on the other hand, is the negative or discriminatory attitudes individuals or larger groups have towards people with mental health issues, their families, and care providers. And this is manifested through social exclusion, housing denial, barriers to employment, and also other examples include misconceptions about people with mental illness as safety threats, having negative emotional responses when someone discloses a mental health concern, and also a person being penalized because of their perhaps a history of mental illness. So someone's mental illness being held against them. I'm always going to be checking the chat just to make sure I don't miss any comments. Okay, and the last one is self-stigma. So self-stigma is the negative attitude, is the negative feelings and perceptions a person with mental health issues have towards themselves. So often this manifests as something internalized. So low self-esteem, lack of confidence, and internal shame towards their own, I'm going to put quotations, condition. It kind of propel like propels someone to deny, prompts someone to deny or even downplay the symptoms of their mental illness due to fear of being labeled as weak, abnormal, or broken. Okay, now I'm going to turn your attention to a quick video. So this is kind of for those of you that may need a bit more understanding around what are some of the myths versus facts around mental illness, just in general. Here's just a quick video to give you to expand your scope.
In this video, I will be addressing some common misconceptions that people have about mental illnesses and how they affect people. Being more aware of the true nature of mental illness will allow us to become more understanding of people with mental illnesses so we can erase stigma. Myth number one: there is no way I can develop a mental illness. Mental illnesses affect people of all ages, races, and sexes. And according to the CDC, over 50% of the world's population will have a mental illness at some point in their life, while 1 in 5 Americans each year will experience a mental illness. Being young also doesn't mean you aren't likely to develop a mental illness. Half of all mental disorders occur before a person turns 14 years old, and 3/4 of mental illnesses begin before age 24. Myth number two: mental illnesses cannot be prevented. There are certain environmental risk factors for mental illness that can be addressed, like exposure to trauma or abuse, unhealthy lifestyles like smoking and substance use, negative thinking patterns, and the inability to cope with stress. But there are some factors that may not change, including genetic and biological factors. Myth number three: people with mental illnesses are violent. Research has debunked this idea by showing that the majority of people with mental disorders are no more likely to be violent than people without them. In fact, only 3 to 5% of violent acts can be attributed to people with severe mental illnesses. However, the presence of substance use disorders along with psychiatric disorders has been shown to increase the likelihood of a person committing violent acts. Myth number four: recovery is close to impossible. The use of different treatments such as medicine and therapy have been shown to improve conditions for people with mental illness and even lead to full recovery. But around 65% of people don't seek help for their mental disorder. Some people may think you can just snap out of it. People with mental illnesses generally require treatment in order to improve. These treatments can address the biological, genetic, and environmental factors that put the patient at increased risk. Just like you wouldn't tell someone with a broken bone to snap out of it, the same logic applies here. Now for a quiz. Number one: true or false? Using medicine for treatment is the only way to recover from a mental illness.
Okay, so I'm just gonna stop the video there. We're just going to move on. I feel like everyone understands the just between the myths and the facts, or just at least some of the myths and the facts. Like I said before, it's not limited to even this video. Hey, now let's discuss mental illness and disability. So, a common misconception is that mental illness and disability are separate concepts and unrelated to one another. This is often due to perhaps default ideas around how disabilities present themselves. For example, sometimes when individuals hear the word disability, what often comes to mind is someone in a wheelchair, someone with a service animal, or with an assistive device. And the common denominator here is that many people tend to associate disability with physical disabilities and often overlook or negate what's called invisible disabilities. And this can include autism, ADHD, obsessive compulsive disorder, OCD, etc. And mental illness does fall under the category of invisible disability. The Ontario Human Rights Code does classify mental illness as a mental disorder or as a condition of impairment. And Ontario laws do consider diverse subjective experiences and cultural influences when determining protection for mental illness. Also, the OHRC does make specific reference to anxiety, panic attacks, depression, schizophrenia, alcoholism, and addiction to recreational drugs as forms of disability, but even they say this is not limited, it is not like limited to this list. Okay, now I want to draw your attention to two primary types of models on how disability is perceived. So the first model, number one, is called the medical model of disability. So it is this one right here. And that basically suggests that disability is perceived as an as a physical individual defect in need of diagnosis and fixing through medical intervention, treatment, and or rehabilitation by subject matter experts. Now, this is a very harmful view around people with disabilities, which is why we have the social model of disability was created. And that basically suggests, so number two, that is number two right here, the contrast. And that states that disability is actually created by systemic barriers and societal attitudes and beliefs that aim to exclude, marginalize, and disadvantage non-able-bodied communities. I'm just going to check the chat real quick. Okay. Also, I probably should have mentioned this earlier. When I share my screen, I'm not able to see participants' hand raises. So if you have a question, please just use the chat. So now I'm going to turn your attention over to another video that I have that addresses the overlap between mental illness and disability, but this is going to be from another perspective. I used to run up. Sorry, I'm just going to mute myself. Can I mute myself really quickly? I believe. Sorry, I'm going to stop sharing for 1 second. Can you all hear now? Thumbs up if seeing everybody let me know if you can hear. Go through puberty and wanting to. Okay, great. I'm gonna keep playing now. Start going on dates with people, and I completely felt the same way. I would have crushes on people and ask them to be in a relationship, and the answer was always no. I felt like it was almost my disability that got in the way of everything. I never felt like beautiful or attractive or anything like that. I never saw anybody on TV or in a magazine that even looked like me. It's always really felt like this is the only thing that people see. They're almost scared to touch you. They're scared to put an arm on your shoulder or give you a hug or hold your hand or do anything like that. Sometimes I get really anxious when I'm talking to people. I often have all these thoughts going through my head like, am I blinking enough? Am I staring at them? Do they think I'm staring at them? You know, what are they thinking about what I'm saying? They probably think I'm stupid. They probably think what I'm saying is stupid.
and I try to challenge all these stereotypes that people have. Usually, to get around, I'm on two walking sticks, and I can't put weight through my hand at the moment because of the fracture, and that's why I'm in the chair. How I sort of got into headspace was I was feeling really, really anxious about something, and I thought, I want to talk to somebody who's going to listen. And I thought, oh, I'll just Google them and see if they have any of this online counseling stuff. And I did, eHeadspace. I find I'm able to express so many more of my thoughts by writing stuff down. Using that meant that I could talk to someone whenever I wanted. I've just started my Masters of Social Work at Melbourne Uni. As a future social worker, I'm really passionate about seeing the whole person. The more that I move into this field, the more I feel like I'm being accepted for who I am and not what.
Yeah, I'm gonna stop that right there. So, like I said, this is from a different perspective. I didn't showcase this video as to suggest that I didn't showcase it to suggest that possessing a physical disability is somehow causes a mental issue because that's not true. What I wanted to capture was this, I was the was how the social model of disability does apply to this scenario, meaning that you see that Natasha had faced various ableist barriers through a series of interaction, like quote unquote minor interactions that accumulated over time throughout her life to reveal a systemic problem. And despite the optimistic, empowering, and inspirational messages like that are towards the end, that are seen towards the end, um, these encounters that Natasha described were to make her feel isolated, invisible, insignificant, and socially undesirable. And she indicated that from a young age, she did internalize this stigma, and it did impact her sense of self-esteem and self-image. And as she stated, she was always made to feel different and abnormal compared to everyone else. And this was despite the fact that she also didn't count herself either, but it still did deeply impact her. And like I said, these barriers do lead to an internalized um, deficit thinking. And this was manifested through Natasha also saying in the beginning that she wanted to conform to more ableist norms. So moving on from that, um, so here we have a breakdown of just an overview of Ontario's mental health care system. So first here we have the primary care, and that is comprised of family doctors and nurse practitioners. This is where people receive initial mental health assessments, medication management, and referrals to specialists. Here we have hospital and specialized care. So this is the emergency psychiatric departments, inpatient and outpatient treatment, and crisis intervention lines. And over here we have community-based services. So that's free or even low-cost counseling, peer support programs, and housing support. And over here, lastly, we have mental health resources that are children and youth specific. So I'm going to get into a couple of these later on, but this can include places like One Stop Talk, Kids Help Phone, Good to Talk, and Children's Mental Health Ontario. And now here I am going to delve into ways of navigating Ontario's mental health care system. And this is going to be all about diversifying your options on how to obtain the support you need. Um, so understanding what organizations you can reach out to as connectors or to consult with. Maybe you don't feel ready to take that step and you want to do some of your own research. Um, on what you're experiencing, or maybe you're looking for something that isn't just for the general public and is more specific to the cultural communities you identify with or belong to. And also, I want to refute one size fits all recommendations and recognize the differences in what people perceive as meaningful and relevant resources and services. So it's not about what's better, what's more effective or better than the other. It's just understanding what may be available and accessible and relevant, accessible and effective for you. So referral pathways. So in terms of referral pathways for adults, adults can choose to take more of a traditional approach and choose to request a mental health assessment from their family doctor or a nurse practitioner, and from there discuss the options for referrals based on the outcomes of their evaluation. Or if you prefer to maybe bypass that process and make this a more, I guess, self-driven journey, you can also contact, for example, Connex Ontario or Health 811 online or call 811. I'm going to talk about that in a few minutes. And on the other hand, for children and youth, the same process kind of applies in terms of requesting a mental health assessment from their pediatrician. Or for those that maybe prefer virtual pathways, there's also Kids Help Phone and One Stop Talk. So, firstly, what is Connex Ontario? So, Connex is a free 24/7 voluntary confidential phone, chat, texting, and email service that helps users locate support and information about mental health services available in their community. Services are geared towards assisting individuals with mental health, substance abuse, and gambling addictions, excuse me, and they can help people at any stage, whether it is to address immediate severe concerns or prevent long-term detrimental impacts. It is run by a team with knowledge on evidence-based resources and referral specialists, and it understands, their aim is to understand that mental health challenges are common and also treatable. And steps like you can access the resource through reaching out to Connex either by phone, text, chat, or email. Tell them what you're experiencing and what kind of help you feel you need. They can suggest services near you, such as counseling, crisis support, or community programs. And from there, you can kind of choose the option that works best for you. Now, in terms of Health 811 online, or like I said, call 811. So you can visit the website or call the number to speak to a registered nurse. And if you are uncertain about the appropriate mental health resources, if you are uncertain about the appropriate mental health resources and support for symptoms, concerns, or perhaps your interests. And it is also a free, secure, and confidential service that is accessible 24/7. Oops. Okay. I'm gonna wait for that to go. So now we have Kids Help Phone. We have more child and youth centered service resources, so like Kids Help Phone. And that is Canada's only national 24/7 e-health service, offering free, multilingual, and confidential support to help all young people. It provides opportunities for users to speak with trained volunteer crisis responders via phone, texting, or online messaging. The website offers diverse support resources tailored to different needs and are community and culture specific. So it has resources for Black youth, body image, bullying, sex, dating, and consent, eating disorders, equity, First Nations, Inuit, and Métis, resources for family and caregivers, to us LGBTQ plus, self-care, jobs, money, housing, a wide range of resources, because they believe learning about mental health can empower youth with the language to communicate how they're feeling. They also offer interactive games, tools, and activities for self-assessments and to gain an understanding on your personal knowledge of mental health and to make safety plans to reduce stress and organize a support network. It enables youth experiencing similar challenges to connect with one another and build circles of support and camaraderie. Also, Kids Help Phone offers resource databases and maps for users to actually search for external in-person and virtual program services and apps within their local community. And I also have I put up the telephone number here just as your future reference. Hey, for One Stop Talk, this is kind of similar, but it is specific to mental health issues impacting children and youth under the age of 18 and their families. It provides free confidential services, offers walk-in counseling with a registered therapist slash clinician to provide immediate support and access during emergencies or urgent situations. It provides counseling. Its counseling is designed to address short-term mental health concerns, and it offers initial assessments to determine children's needs and future next steps and plans. Children between 6 to 7 years old do need to provide consent for their parent slash caregiver to participate in the support process here. So the contact information, their email is right here, and their availability is from Monday to Friday, 12 p.m. to 8 p.m., and Saturday from 12 p.m. to 4 p.m. Okay. Now moving on to some online assessment and self-help tools. So this is going to answer some of your questions around what exactly are these, or just some examples of what they could be. So a couple of these tools are facilitated by the Canadian Mental Health Association, so CHMA. So I'm just going to do a quick intro on exactly what that is to give you some context.
CMHA is almost a philosophy. It's that if you look at our longer term vision of mental health for all, CMHA is about reaching that goal. It's how do we provide better supports for people in need? How do we provide better access? How do we improve our services constantly? How do we improve public awareness? How do we help people understand that mental health is not something different? It's part of health. How do we advocate with the government to give equity of services across the province and show that mental health services actually reduce things like unemployment and use of the court system, and that if they invest heavily in this part, we can make society better and do it at a cost that's less than we currently spend on all mental health challenges across the system.
Okay, so the first one is the mental health meter provided by CMHA. So basically what that is, it is a quick and easy mental health screening test that measures 5 primary determinants of adequate mental health, and and this includes ability to enjoy life, resilience, self-actualization, balance, and emotional flexibility. And it is not a scientific test or a substitute for professional advice, and requires honest answers in order for users to receive authentic results. And just the steps for accessing it are fairly easy. So just visit the website outlined right here. Oopsies. Sorry about that. Complete the survey that's outlined on the website, and then from there you can just review your results. The next one is Bounce Back Ontario. So it is provided by the Canadian Mental Health Association. It is a free skill building program designed to help adults and youth 15 and over manage low mood, depression, anxiety, stress, or worry. And it can be delivered over the phone with a coach and through online videos, which you can get access to, that will support you on your path towards mental wellness. And some of these tools consist of workbooks that teach coping strategies, perhaps address sleep disturbances, and coach you on how to become more socially assertive, problem solve in a practical manner, and also address unhelpful thinking patterns and build and improve your existing relationships with your loved ones. And oops, oh my goodness. And there are two ways in which you can access this service. So the first way is complete the referral form with your family doctor or nurse practitioner, or you can complete it independently. So the online self-referral form. After 5 business days, a bounce back coach will contact you for an information session regarding program fit. And then clients will typically receive up to 6 phone calls over, you can do like a 3 to 6 month span to work through the workbooks tailored to your program. The other option, on the other hand, is to visit Bounce Back online platform and create a free account to access videos, worksheets, and self-guided workbooks on topics like the ones I just mentioned previously: assertiveness, sleep issues, and thought management. Okay, just for the sake of time, I'm going to skip past this video. It is just outlining the steps for accessing Bounce Back. But it just regurgitates what I just said. So the Mind Beacon assessment. It's provided by Mind Beacon organization, which delivers digital therapy resources. This assessment is a 30 to 60-minute questionnaire that obtains information on mood, stress, and daily functioning. And results are viewed by licensed professionals to determine a cognitive behavioral therapy, a CBT program most aligned with user needs. Checking the chat. No, we're good. Okay, and the steps to access this. So just create an account through Mind Beacon platform registration. Make sure to verify your account using an email link. Complete the questionnaire at your own pace and choose your path to our standard versus diagnostic and obtain a customized plan. Okay, now on to community resources. So I'm going to mention a few. So the first one is called Your Support Services Network. And basically what that is, it is a non-for-profit organization that supports adults and children with developmental disabilities, mental health needs, and crises. It provides case management services rooted in trauma-informed care and can include flexible supports, dual diagnosis, and community treatment orders. It offers one-on-one counseling for issues such as mental health concerns, caregiving and parenting challenges, and addictions. It enables people to connect with other individuals with similar experiences and move in their wellness journeys together. And it collaborates with other agencies to help children and youth create coordinated plans to support their physical, social, emotional development. The next one is called FH Care, Asian Mental Health and Wellbeing. So this is also a non-for-profit organization that provides culturally rooted mental health care services to East and Southeast Asian communities. It offers case management services to help individuals navigate challenges, including mental illness, housing, and crisis recovery. It provides psychotherapy services for those managing stress, anxiety, depression, or life transitions. It offers peer-led recovery programs for individuals to empower each other and grow in communities. It offers support for families navigating a loved one's mental health journey and provides mental health training to build skills and reduce stigma. Okay. This one, Taboo Community Healthcare. It is a community-driven healthcare organization that is committed to serving Black identifying populations in the GTA. It offers comprehensive primary care services, including diagnostic assessments and treatments for illnesses and chronic diseases, provides chronic disease management using a holistic, culturally affirming Afrocentric approach, offers health and wellness services to seniors and new families, and implements advocacy projects that combine other Black-led agencies to raise consciousness around the role of anti-Black racism on the mental health of Black communities. Okay. Okay, this is going to be, nope, we still got 2 more. Okay, so the Center for Immigrant and Community Services is a community-based nonprofit organization that supports newcomers and their families build lives in Canada. It offers settlement guidance to help newcomers understand essential services, including housing, healthcare, education, and community resources in Canada. It collaborates with the Toronto Tenant Support Program to understand their rights and resolve rental disputes effectively. It provides employment services to assist newcomers with job search strategies, resume preparation, interview skills, and successful workplace integration. It offers community health and wellness programs through workshops, health education, and initiatives for all ages. Okay, this is going to be the second last one. So this one is Rainbow Health Ontario, and that is basically a nonprofit, another nonprofit organization, but this is dedicated to serving LGBTQ plus populations through providing equitable healthcare without barriers, stigma, or erasure. Provides a series of 2S LGBTQ plus community-oriented health resources for navigating issues such as smoking addictions, sexual health issues, and youth mental health concerns. Offers service provider directories for individuals to locate professionals that are 2S LGBTQ plus positive. It offers a website glossary of 2S LGBTQ plus terms and definitions to better understand LGBTQ oriented health. And also it has a podcast that discusses challenges and innovations in 2S LGBTQ plus healthcare. Now, this last one is Kinark Autism Services. And this is also a non-for-profit organization that provides evidence-based support to help children and youth with diverse abilities. It provides service directories with a search engine, actually, to access a wide range of services, offers applied behavior analysis services, provides connections for students so children with autism can experience positive transitions into school. And it offers services to help families with newly diagnosed children with autism select appropriate interventions. Okay, so we've reached the end of our workshop for today. So this is just the OneHub contact information right here. Our email, info@onehubgrowth.org. Here's our phone number, our address, and our office hours are from 9 a.m. to 5 p.m. from Monday to Friday. And thank you all so much for attending and engaging in this workshop.